There is that whole idea of the Pottinger cats experiment where Pottinger was a medical doctor, I think in the 50s, and he had different cats and he would feed some raw food, some processed food. And then there was, I think within 3 generations of eating processed food, the cat group that ate the processed food lost the ability to reproduce. So there is this idea that we're on like the 3rd generation or so of this Pottinger cat experiment. And there are some people that are just at that end level where they may have reduced fertility just because they're living out the Pottinger cat experiment in real life. It's possible some of that is the case. So we want to do our best to really emphasize a whole food, nutrient dense, anti-inflammatory diet. We know that pregnancy involves healthy hormones. And as a starting off point, we don't want to eat foods or toxins or hormones in our animal products that could throw off our fertility. So the first step in any fertility program, nutrient dense, anti-inflammatory, low toxin, that's going to mean an organic whole food diet. That's going to mean cutting out hormones and antibiotics and pesticides and GMOs. And a lot of these pesticides are xenoestrogens. They mimic hormones as well because they affect the insects from reproducing. That's how they kill them, right? And so it can also have an effect, a cumulative effect on women and men on the sperm count, women on the fertility side. So diet is going to be one of the first things. And the second thing is going to be blood sugar stability. I think this low fat, low cholesterol era, skipping meals, fad dieting has prompted lots of insulin resistance, lots of reactive hypoglycemia, meaning too much sugar, too much carbs, blood sugar goes up and then spikes down, which then creates this insulin surge. And high levels of insulin is really what's behind the leading cause of infertility in women, which is PCOS. That's Polycystic Ovarian Syndrome. And that the mechanism there is high levels of insulin, insulin resistance, insulin surges, thus increase androgens. And then the androgens also can throw off prolactin, and then that can dysregulate a woman's cycle. So you can see there's a lot of different hormonal rhythms that can go off together and create many issues. So the major mechanism is going to be this insulin resistance followed by increased level of androgens, free testosterone, and then also prolactin issues to boot. Those are kind of that's the big initial sequelae that we see. And of course, usually if they're eating a lot of carbohydrate and junky foods, people that are missing that level of awareness tend to also be consuming the pesticides, maybe going low fat, low cholesterol, maybe not getting high quality animal products, and they're getting all the hormones from there too. So that's like kind of my first 2 things out of the gates.
Yep, well said. And just want to quickly go over the conventional treatments for infertility, especially resulting from PCOS. That's what we did on our gut health podcast, kind of the conventional versus functional gut health. People loved it. I got a lot of good feedback on that. So thanks for the feedback. But it's not pretty. You mentioned it's not root cause, and it's not. So you've got this clomiphene, which is the American College of Obstetrician Gynecologists recommendation. That's their primary medication for PCOS patients with infertility. It indirectly causes eggs to mature and be released. And then you've got metformin, which we just talked about, the insulin resistance problem. So metformin would come in and help. They talk about it helping just in terms of ovulation, but that would probably be just due to helping to lower insulin.
That's what it is.
Okay.
Yeah, metformin and glucophage, that's a big one.
And then you've got the letrozole. This is a drug that slows estrogen production, causes the body to make more follicle stimulating hormone, FSH, which is what you need for ovulation. And what else here? They've got just other hormones in shot form, which are going to cause ovulation. And then the craziest one, let me just read this one here, and then we'll move on into the functional. You've got ovarian drilling. And so the surgeon makes a small cut in your abdomen, inserts a long, thin tool, and they use a needle with an electric current to puncture and destroy a small part of the ovary. This surgery leads to lower androgen levels, which may improve ovulation. So, wow. And if you do all those and you don't get pregnant, then you could go to the IVF, which is where the sperm and the egg are put in a dish outside the body. Fertilization happens, and then they put the fertilized egg into the uterus, and then boom, there you go.
Exactly.